Here's Monica talking about foods for bone health. Go on, Mon.
Hi everyone. So osteoporosis or osteopenia, which is the condition that you might be diagnosed with prior to being diagnosed with osteoporosis, or just general bone health, you might be worried about osteoporosis in the future or you have a family history. There are a lot of dietetic strategies that you can implement to help keep your bones stronger. Most of us know that weight-bearing activity is important for bone health, and that can be anything from walking and running, weights, and it's good to talk to an exercise physiologist or a physio about that if you're particularly worried about your bones, or if you've already been diagnosed with osteopenia or osteoporosis. In addition to that, it's quite a good idea to go and have your bone checked with a DEXA scan, which is the best way of seeing what your bone density is like. And you can talk to your GP about that, and they might refer you on to a rheumatologist, a specialist who works in the area of bone health. But from a dietetic perspective, there's quite a lot that we can do. Most people are aware that calcium is really important for bone health, and having 2 to 3 serves of calcium-rich food a day is helpful. Now, what a lot of people might not know is that animal protein can actually encourage the leaching of calcium out of your bones. And it's a little bit of a controversial area at the moment, and there's a lot of research being done. But we know that potentially milk that's dairy milk, red meat, might actually in large amounts, and especially in the absence of enough fruit and vegetables, cause a higher acidic load in your body, which can actually leach calcium from your bones, because calcium is there to help buffer that acid. So if you can, some of your calcium-rich foods might come from soy milk, or calcium-fortified tofu, or almonds, and then you might have a balance between dairy milk, as well as making sure that you have enough fruit and vegetables that can also help buffer this acidic load. And you can always talk to a dietitian if you're not sure and you're not familiar on how to prepare plant foods such as lentils and legumes and tofu, because an accredited dietitian would be more than happy to teach you how to easily cook with these foods at home. So calcium is really important, as well as fruits and vegetables. We also know that vitamin D is really important for bone health, and it can be quite hard to get vitamin D from food sources. So a simple blood test can let you know whether or not you are low in vitamin D, and then a supplement might be something just to help with your balanced diet to ensure that you pop those vitamin D levels up. In addition to that, caffeine and alcohol can also cause leaching of calcium through your kidneys, for example. So being careful with coffee, strong tea, caffeinated drinks such as Coca-Cola, or energy drinks like V and Red Bull, which are quite popular now. Reducing these can really help with your bones. And in addition to that, just minimising alcohol, which is also helpful for a lot of other health conditions as well. If you smoke, it's good to quit smoking, because we know that smoking is related to osteoporosis, and then making sure that if you're on any medications for your bones, that you remember to take them consistently. So let's just recap that. Quit smoking if you smoke, have a diet that has adequate calcium and vitamin D, then have a good amount of fruits and vegetables. You may choose to eat some plant proteins and swap them for some of the animal proteins that you eat, and to reduce your caffeine and your alcohol intake and keep nice and active.